Welcome back to Great Day Wellness Wednesday. There's one assignment schools want students and parents to complete before class starts this fall. Get your required vaccinations. If money to pay for it is an issue, our next guests are helping to cross that off your back to school list for free. Welcome back pediatrician Dr. Ali Nakvi with UT Physicians and State Representative Armando Walle. Good morning. All right. I actually heard someone the other day say, I don't know why we keep pushing these vaccination things because it's not like there's a polio outbreak out there. There's a reason why there's not a polio outbreak.
Yes, exactly. So vaccines have been very successful. So as soon as they were introduced, we saw like a huge decline in those diseases that they prevent, and we don't see them anymore. But it doesn't mean that they're not around.
Right.
So
because they are lurking, right?
Yes, yes.
Looking for an opportunity.
Mm-hmm.
Okay.
And with international traveling, people going traveling abroad and coming back, they can easily start spreading if the vaccination rates go down.
Yeah. So. All right. Representative Walle, get us up to date on what the rules are. I think there used to be a time where you could not come into a public school without having your vaccinations. And we know there are several things like, I think, Boy Scouts and stuff like that want you to have your vaccinations. What are the rules?
So right now it's highly recommended, but it's not mandatory. So we do mandate that children receive vaccinations, but there are exemptions. So based on religious or some type of belief issues where you hold your child back from actually vaccinating. So we've seen in the state of Texas a rise in those exemptions. And so as the doctor mentioned, vaccinations are important to prevent the spread of disease, let alone at home where you might get them from abroad, but in your school setting. So it's important that the state of Texas continue to encourage vaccinating their children.
Because it takes just one child to set it off, right? And Dr. Nakvi, there are certain diseases that can be deadly, we know that, but there's also the complications of, we can avoid some suffering, things like what?
So for example, like with measles, so vaccines prevent complications and like serious diseases. So complications from measles could be as severe as pneumonia, encephalitis.
Pneumonia can be deadly. Right.
Exactly. Yeah. And then polio can leave you paralyzed for life. So we can easily avoid those complications. So if we get those vaccines on time, so then you can easily prevent them.
All right. So one of the issues that people have, of course, we know one of the top issues when it comes to constituents is healthcare and access to healthcare. So you're going to remove this stumbling block for some parents.
So absolutely. So that's a great segue into the effort that we're working with, and I want to thank UT Physicians and our faith-based partners, Greater Jerusalem Missionary Baptist Church and New Bethlehem Baptist Church. They're on Crosstimbers and Jensen. We're going to have a free clinic. So no cost to families to get their kids vaccinated on July 27th. So we're just so grateful to be able to offer this service, and thank UT Physicians for actually providing the funding to be able to get a lot of our kids in our neighborhoods vaccinated.
Yeah. When kids are going to get vaccinated, do they need parents need to show up with any previous shot records they may have?
Yes, definitely. So that will be very helpful for us to decide which exact vaccines that they need. So we definitely highly recommend them.
Okay, take us through. The vaccines I think we get when our children are born, right? So we leave the hospital going, okay, they're protected. And then there's that, okay, come back in 3 months or come back in, right? We have to keep up with that schedule. Yeah. And then even kids are a little bit older heading off to college. There's the meningitis and things like that have been added in recent years.
Yes. So the way vaccine schedule is designed is, so it works at the optimum time. So when you're most likely to get those diseases, so that's how that's the time that you get that particular vaccine.
Okay.
And for a lot of vaccines, so it's just not one shot. You need a series of 2 or 3 vaccines to get your immune system maximum strength.
Yeah. So you got to keep up. All right.
Yes.
Not just vaccines, but it's kind of going to be a cool atmosphere, isn't it? So tell us what else is going on there that parents can have access to.
So absolutely. So we're going to have backpacks. We're going to have a lot of services, screenings for the children that are there. Last year, I think there were about 150 parents and families that showed up. This year, obviously, with this push, we're looking to expand and make it bigger and better for a community that's medically underserved in that East Texas Jensen area. And so with the state not expanding Medicaid, it's important that these communities, but for this clinic, this particular part of town in North Houston wouldn't have access to health care.
Yeah, and I gotta say, it's like government can't do it all, government won't do it all. This is a great example of that kind of private-public kind of partnership. So UT Physicians, thank you very much for stepping up, and thank you for spearheading this. You can join the annual immunization day at UT Physicians Multispecialty Jensen on Saturday, July 27th from 9 a.m. to 12 p.m. Children ages 4 to 18 will receive no-cost vaccines, school supplies, and a healthy food gift giveaway provided by the Houston Food Bank. Supplies are limited to the first 100 students. Shuttle service will be provided every 20 minutes from Greater Jerusalem Missionary Baptist Church. And for more information, call 1-888-4UT-DOCS or visit utphysicians.com.